welcome for this afternoon session Melanie Sears. Melanie is a trainer for the Center of Nonviolent Communication since 1991. She works with businesses and hospitals and long-term care homes, hospices, individuals, and parents in transforming their usual way of operations, interpersonal interactions, and dealing with conflict to one in which is more compassionate, more conscientious, and effective. So Melanie presents nonviolent communication at conventions and universities and at churches. And she's been on the radio and on TV, and we are so blessed to have her here. She's written a few books, including Humanizing Healthcare and Creating Cultures and Compassion of Nonviolent Communication. We have a handout that Melanie has provided for us, and it's in the chat. And Val may also share it on the screen at some point. But if you have that handout, access it. It had a pretty colorful giraffe on it. There's the giraffe. Kind of looks like this. I think we should just welcome you, Melanie, and it's so great to have you. And the floor is yours.
Thank you, Ruth. Sometimes people have a difficult time learning nonviolent communication from a very non-fictional point of view. So to update you, I'm writing a fiction book about an alien who gets accidentally left at Earth. And she's from a planet who uses nonviolent communication as their healing language. So hopefully it'll come out this next year. It's called Zuma, Earth Alien. And it's all fiction, but it's got a lot of nonviolent communication in it. If you have a hard time learning or understanding it, you can kind of learn it through this author. So that's what I'm doing right now in my retirement. I'm writing fiction. But when I wrote the book, I wrote the book Humanizing Healthcare, Creating Cultures and Compassion with Nonviolent Communication. I was working in inpatient psychiatric. I was a nurse for 35 years. And I worked in most areas of the hospital and in home care and in hospice. I was both a nurse in hospice and a marketing person, because being a nurse in hospice is a really hard job. You're taking care of the sickest patients, and people are grieving, and oftentimes they're not really accessing their grief, and so they project it on the nurse that comes in. It's a very difficult job. But the great thing about nursing is there are a lot of lateral moves, and that was my strategy. I made a lot of lateral moves in my life in nursing, but I learned a lot about taking care of patients from preemies to dying patients. So when I worked in inpatient psychiatry, all my nursing jobs were difficult, but that one really took the cake. And that was in Seattle that I worked in, and the sickest patients from 3 states would enter into the hospital I worked in. And there were so many unconscious and violent dynamics going on in that unit that I either had to change jobs or I had to figure out how to make lemonade out of lemons. So I did the latter, and that's when I wrote my book, Humanizing Healthcare. I was also working on my PhD in transpersonal psychology, so I used the book as my dissertation project. And it was also a way to give myself empathy for working there. It was very difficult because the culture was very violent, and I was studying nonviolence. So I thought, well, I'll contrast with what's going on here with the principles of nonviolence. And this was kind of new at the time. I mean, it was published in 2011. And I think since then, things have gotten a little bit better. But back then, they were pretty difficult. So I wanted to read you an excerpt from my book, Humanizing Healthcare, just to give you an example of one way that the empathy can be used. One thing we teach in nonviolent communication is how to give accurate empathy, and both to ourselves and to others. So this is an example of empathy toward others. One evening, upon arriving for work, I walked past a too common scene in the hallway. A nurse was standing in the hallway outside a patient's door, yelling the repeated demand, go sit on your bed. Meanwhile, the patient was hanging on to the side of the door and insisting that she wanted to come out. The situation appeared to be locked in a classic stalemate born of unmet control needs. I looked in the small cell-like window and said, "Hi, Mary, go sit on your bed. I want to come in and talk to you." When Mary saw me, her face lit up, and she ran over and sat on her bed. The nurse standing at the door said, "That's amazing. How did you do that?" I had no magic potion, no pills or tricks. However, I had worked with the patient the week before, and using the tools of NVC, nonviolent communication, had created a nurturing connection with her. The patient was not willing to submit to the demands of a staff member whom she did not feel a connection, yet she cooperated willingly when treated with respect and compassion. So the book is kind of about my journey working in that inpatient psychiatric unit. And today, one of the tools that got me through it was nonviolent communication and self-empathy, how to give yourself empathy, and which we all need, and no matter what the job is. There's always things that happen that are distressing. So I coped by giving myself empathy. Other staff members coped by shutting down or rising to the top of the pack by violence or judgmental languages. And those staff members were actually celebrated, the violent staff members. When someone gave a traumatic injection, they were going, "Yeah, did you see what she did? That was great," you know? And yet I was treating patients with empathy and respect, and they thought I was weak. Are soft. But they couldn't deny that my patients didn't end up in seclusion and restraints. So something I was doing was working, but they really didn't want to look at that. So this book kind of illustrates some of those examples. It's all full of stories that happened on that unit. It was actually really fun and cathartic for me to write. So it's really not easy to go against the norms of the culture. And back then, the culture was violent, and I was going against those norms. But I also had a dilemma. I wanted to be in congruence with my inner values, and that was more important to me than belonging, than having a sense of belonging, giving up myself so I could belong to this violent culture. So I refused to do that. You never know where life will take you, and sometimes the most difficult situations will land you into a better life in a lot of ways, depending on how you approach it. So I decided to approach it by writing this book, by practicing what I preached. And so this book has now gone around the world and is translated into German, Korean, Chinese, and Japanese. And I'm glad that it can contribute and hopefully contribute to everyone's well-being who works in the healthcare industry. So I'd like to give a model of the self-empathy model, and I'm wondering if any participants would like to illustrate this model with me. So what I would do is I would talk about one concept, and you as a participant would respond with your personal experience of that concept. If not,
I'll
you
give
would,
it a try. Yep.
Ruth, you're brave. Okay. So the first step in self-empathy is to connect what's going on in your head. So think about a situation that maybe triggered some distress in you, and think about what went on in your head during that. What were your judgments? Just let it rip. Don't monitor them. Don't try to be nice. Don't try to be politically correct. Just let it rip.
They shouldn't be so aggressive. They shouldn't be so loud. Um, I'm not very comfortable with what they're feeling or saying to me. I don't appreciate that type of language towards me. Um, I'm feeling a little threatened standing here, but I really can't run away from this because this is my job. Um, Often people, oh, the other nurses kind of put me in these situations and I don't feel sometimes I can deal with it. But here I am. This is my caseload. I got this lady today.
Okay, good. So the first step is Marshall Rosenberg, who created the process of nonviolent communication probably 55 years ago, said, enjoy the jackal show. The jackals are how we're kind of socialized to communicate. We use puppets to demonstrate the principles, some of the principles. So the jackal puppet expresses their feelings and needs. This is jackal in terms of blame, criticism, judgments, analysis. It's kind of how we're socialized to communicate. And so learning nonviolent communication is difficult because you have to kind of unlearn this language of the jackal. So Marshall says, in this case, enjoy the jackal show. So spend some time noticing what your thoughts are. If you have a journal, write them down, because you might need to use them later when you're learning this language, the language of the giraffe. See, giraffes speak their feelings and needs in terms of feelings and needs. So it's very clear. It's hard to misunderstand them. So as the jackal, some of those jackals that you expressed, just enjoy them. Just know what they are. You don't want to shut them down, because that anything you push down is likely to come out at another time in a not kind way. So we don't want to push down our feelings. We want to really find out more about them and transform them, hopefully by understanding the giraffe. So the first step, I'm wondering if the participants are following along with us by thinking of their own examples and what are their judgments or analysis or blame. If anyone wants to shout out their own real quick, we could do that.
People can write it in the chat too. Oh, someone said I messed up. What's wrong with me?
Mm-hmm. Anyone else? Why would you think that? Yeah. I know when I started working in inpatient psychiatry, my thought was, this job is a nightmare. So the second step is express what the observation was. So in nonviolent communication, we learn how to separate observation from evaluation. An observation is something a video camera can pick up. So an evaluation, most people evaluate, they don't observe. So most people, you see something outside of yourself, it goes through your filters and it comes out into your internal representation of reality. It's not reality, but most people think it is reality. So we're going to learn how to observe before it goes through our filters to say what this is that triggered our response, that triggered all those jackals. So Ruth, can you figure out your observation?
Someone's yelling at me. They're physically moving really close to me. They're agitated. They appear to be agitated, and
Oh, that's probably enough. Yeah. Does anyone hear any evaluation in what Ruth said, or is it all pure observation?
I said they appear to be. Yeah.
They appeared to be.
Yeah. There's.
let's see, they are agitated, maybe slightly one. Yes.
Yeah.
That is an analysis of what's going on with someone else. That could be an evaluation.
Because their fists were up in front of me.
Oh, there we go. That would be an observation. A
That's an
video camera could pick
observation.
that up. But
Yeah.
can a video camera pick up they were yelling at me? They can hear somebody talking in a loud voice, but yelling is actually an evaluation. Someone can talk louder and louder and louder, and there's just different ranges. It's really hard to put that into a clear observation, but what you can say is they were talking louder than I enjoyed. They
Yeah.
had their fists raised. That's definitely an observation. Your analysis that they appeared to be agitated is an evaluation. What made them appear to be agitated? Were they shaking? Were they staring? Of course, that's an evaluation. Were they looking at you? Intent.
They were definitely looking at me and yeah, shaking their fists at me, like directly at my
Okay.
face.
Okay, good. So those are some clear observations. Excellent. Does anyone else want to write their observations in the chat according to your situation? What does that chat say? Someone can talk louder.
Someone can talk louder without being violent, so the body language needs to be
It's true.
observed and
Yeah.
evaluated.
Yeah. I agree. Okay.
I agree.
All right, does anyone, should I give you another minute if you want to write your observation? Okay. So just doing that, separating observation from evaluation, will begin to soothe you internally. You know, because when you think someone's yelling at you, that's going to cause some inner turmoil. Whereas you think he's talking in a louder voice than I enjoy, it's going to be more self-soothing. So the second step in self-empathy is, what did you feel when that happened? Okay, so this is a time to check your feelings list. Does everyone have access to their feelings list? Okay, so look on the feelings list at the feelings and pick one that kind of describes what you might have been feeling at that time.
Yeah, and people are saying things, their immediate response was usually to get defensive or
Yes.
apprehensive or indignant, possibly. I felt scared, threatened, humiliated, insulted, hurt. I felt guilty.
Good.
I might have been afraid. I felt fragile in my story.
What did you feel, Ruth?
Fragile.
Fragile?
Yeah.
Okay. Kind of vulnerable?
Yes.
Okay. So some feelings sound like feelings, but they're really thoughts. Like feeling scared is definitely a feeling, but feeling threatened is actually a thought. You're thinking someone is going to get you. So when you're thinking that someone's threatening you, you're going to like build a wall and, you know, protect yourself. But when you're noticing that you're scared, you know, it's feelings underneath those thoughts. Sometimes the thoughts can lead us to our feelings. So our feeling is scared. Your feeling, Ruth, is vulnerable, anguished, embarrassed, upset. Upset is a kind of vague feeling, but it's, you know, it'll work. Scared. Sometimes it can be a cause of curiosity in me. Oh, well, that's excellent. What's behind this outburst?
Mm-hmm.
That's the next. That's
the next step.
Yeah. Overwhelmed. Yeah. I know when I worked in patient psychiatric, I was often Well, it depended on the situation, but often I was hurt, I was scared, I was overwhelmed, I was apprehensive. So all those feelings. Um, psychiatric nurses get assaulted more often than police officers, and I did get assaulted a few times. And one of my jackals, this one guy, he was in the psych unit because he was always going like this, like a fighter, and he was total care, but you had to avoid his fists, when taking care of him. And of course, we were short staffed. We're always short staffed, So I only found one other person to help me to pull him up in bed and turn him and do all that nursing stuff. And I had to let go of one of his fists while he's pulling him up in bed, and he socked me right in the mouth. And my jackal thought was, why are we keeping this guy alive? I mean, my jackals can really go to town. I had a lot of jackal thoughts come up, and my feeling was, what was I feeling? I think I was a little scared. I was hurt. Well, I was angry. And so it's important to be able to give yourself empathy in those situations. I feel like psychiatric nursing is the hardest type of nursing. You have to have a lot of compassion. That's true. Powerless. That's another good word. So some words sound like feelings, but they're really thoughts. So some of these words are abandon. I felt abandoned. I used to use that one. I remember before I studied nonviolent communication. You abandoned me. I felt abandoned. And these words are actually more common than actual feeling words. So abandoned, abused, attacked, betrayed, boxed in, bullied, cheated, coerced, co-opted, cornered, diminished. A lot of them have an ED on the end, so you can tell that they are actually thoughts. Distrusted, interrupted, you interrupted me. That's so common. Manipulated, misunderstood, overworked. That's a good one for nurses. Of course, we are a bit overworked, but it's a thought. It's not a feeling. Provoked, put down, unsupported. But anyway, so there's a bunch that are actually thoughts. The feelings list is pretty comprehensive, but not totally. So you could have feelings that are not on the feelings list. So the next step in nonviolent communication for self-empathy is to identify what needs are being met. Needs are, the reason why we want to identify needs is that needs are universal. Everyone in the world has the same needs, and needs are driving our feelings. Now we're learned that other people cause our feelings and we cause other people's feelings, and that's just not true. So if you don't learn anything else in this talk, remember that. Other people don't cause your feelings. You don't cause other people's feelings. Then what causes our feelings? Some feelings are caused by our thoughts, and some feelings are caused by our needs. Our needs are often hidden. We're not socialized to think in terms of human needs. But look at the needs list and see if there's a need that was not being met in your situation.
I guess for me, it was security and safety.
Yes, I would say those are both very important needs.
Mm-hmm.
For me too, security and safety.
Mm-hmm.
Space, very important.
Right.
Appreciation, absolutely. I never felt like I got much appreciation as a nurse. Communication, respect. I never got much respect either. But I did find a phenomenal happen. I was actually very distressed at not getting my need for respect met as a nurse for many years until I learned nonviolent communication, and then I began respecting myself. And then, lo and behold, the respect showed up outside myself, and I started feeling respected. So sometimes when we think we're not getting that need met, it might be because we don't have it inside of ourselves.
Mm-hmm.
I think the presence one kind of hit me because needing to remain present with myself in the face of whatever patient's presenting to me. and reminding myself I'm also called to be present to them, no matter how they're presenting themselves. So it's like, but it's that basic core thing of being present to myself and attending to myself as this
Yes.
comes at me.
So someone was coming at you and your own need for presence wasn't met?
Well, it's just the initial kind of like when you get hit with something. This was verbal from a hospice patient, but it was verbal, but it was very intense. And we'd actually had a relatively good relationship over the course of about 2 weeks. And then, of course, their anger was starting to express itself a bit more. And I happened to be in the way of it one day. And so it just, it was just that, but that moment that it happens, the first thing is, what did I do wrong or whatever, it's kind of that thing. But then realizing, okay, Ian, stay present in the moment.
So you remembered to be present, and it was
Yeah.
really difficult to be present in the
Yeah.
face of anger.
Yeah.
Mhm.
Yeah. And that's actually, you're in a position to really learn these skills, because things come up all the time that you can practice. You can practice presence, and presence to me is a precious, precious need. And it's very akin to empathy. It's not, you're not verbalizing empathy, but you're kind of, it's kind of nonverbal. It's kind of nonverbal presence. And presence is staying kind of in your own shoes and not letting the wind sway you around. And being present, focusing your energy on the other person, or on yourself. What's going on with them? What's going on with me? Sometimes, when it's difficult for you, focus your presence on yourself, and find out, what are my feelings that are going on right now? I I noticed once I went into a patient's home, and this caregiver came at me. She was very angry, and I tried to give her some empathy. And she says, "Don't patronize me." And I realized, because I was giving her empathy from a place where I was very fearful myself. So instead, I would have liked to give myself the empathy and just been more present. And I think being present is being congruent. So Ruth, what did you say? Safety, security?
Those are my feelings. Oh, those were my needs.
Yes.
Those were my needs.
Okay. So those needs are causing your feelings. The feelings that you expressed, what were they?
Scared, fragile.
Okay.
Yeah.
Good. So you were able to determine your needs because you knew what your feelings were. And that takes practice. It took me probably 6 months. And one way I got acquainted with my needs was I would talk about something and somebody would reflect my needs back. What was going on under this language that I spoke, and I spoke it very well. What were my needs? What was the giraffe underneath the jackal?
Melanie, there's people talking about mourning as a need.
Mourning, I think grief and mourning is a need.
Yeah, absolutely.
Let's see. I find that something that can lack is acknowledgement. Sometimes, where'd that go? Sometimes you want to feel heard, especially when difficult situations happen. Absolutely. Everyone needs to be heard. And I found that when I was distressed at work, I really needed empathy. And this system was just not set up to give me empathy. I couldn't even find a place to go and call a friend for empathy because there was no secluded place that I could use. So, in any system that's set up, I hope that a space is set up for that. And maybe even, the manager has empathy skills. That would be something delightful. Sometimes I may feel like I fail the patient because he escalates and I fail to de-escalate the situation. Yes, nonviolent communication is the most powerful tool I have found for de-escalating a patient. And it worked really well with my psych patients, even though they were on a ton of medications and were psychotic. Nursing is a very selfless job that requires you to put your needs on the back burner in order to be there for your patient. But I feel like a lack of putting yourself first can lead to escalating things further. Yeah, I like that. Well, because we're socialized to give up our needs and take care of the needs of others, both women and caregivers. So in nonviolent communication, what really helped me was learning to put my needs first. And it may be hard to understand that putting your needs first would be less violent than stuffing your needs down and trying to meet the needs of others. Because if you do that, it's not going to be effective. The patient is going to sense that it's not authentic. It's not coming from a pure place in your heart. So putting your needs first was one of my practices. And that's what I did with self-empathy, putting my needs first for empathy. When I couldn't get it from outside of me, I tried to give it to myself. Sometimes that was not as effective as getting it from outside, but at least it was a try. Let's see. Sometimes it's tricky for the helper to appreciate their own needs. It's absolutely true. Yeah, so I don't know what you need to learn how to embrace your own needs, but it's an important skill to learn. To unlearn this, to unlearn giving your needs away and putting other needs first.
When I was a nursing student, someone told me that I was a bit of a doormat.
Ah,
To put my needs first. And I
okay.
instructors say, Ruth, you need to know what your needs are.
Oh,
Yeah.
Someone said that to you?
They did.
That's amazing.
Nurse manager. Yep.
Wow. She said you need to know what your needs are and put your needs first.
Yeah. She says you're a bit of a doormat, Ruth. Good.
Well, you know, that is true giraffe. There are 3 stages to becoming a giraffe. And the first stage is doormat. You let everything walk all over you.
That's right.
The second stage is the stage of obnoxious. So you may find that whoever's been to my talks will become starting to become a little obnoxious. You're not the boss of me, or whatever. That's not giraffe, but it's on the way. At least you're not being a doormat anymore. And then the third stage of becoming a giraffe is learning to speak your feelings and need directly, learning to embrace them inside yourselves too. You'll save a lot of money on therapy too. Is someone trying to get my attention? Waving.
Ashley says, it might sound silly, but I made a sign, feel your feels.
Oh, and where'd you put the sign?
Ashley, where did you put the sign? People liked it. She got 3 hearts. People are resonating with that.
So my office, my bathroom mirror,
yeah,
my laptop.
Good.
Yeah. And it's important to learn how to be assertive without being aggressive. Or abrasive.
Abrasive.
Yeah. And that's why nonviolent communication can be powerful, because it's a very gentle, very trauma-informed language. It's a friend of mine who's very well educated in trauma-informed care. She says giraffe is the gentlest trauma-informed language that she's found. So it also takes responsibility for what's yours. And what is yours is your feelings and your needs. Other people don't cause them. You don't cause other people's feelings and needs. So if you own your own feelings and needs, you're much easier to be around. People sense when you don't, because any day that you don't own your own feelings and needs, and you don't own them, you're going to be projecting them out there into the world. And people can sense that and they become defensive. Okay, so that's the third step, needs. Needs are universal. So there's a difference between needs and strategies. And people get them mixed up all the time. So I did a group when I worked in inpatient psych, and the patient said, I would say, well, what brought you into the hospital? And the patient would say, Well, I was distressed. They could usually name their feelings. So I jumped off the bridge. But they would totally skip over their need. And I said, well, what needs in your life were not being met? And after we talked a while, it started to come clear that their need for connection wasn't being met. Their need for meaning wasn't being met. So it just would have made more sense if they had said, yes, I'm very distressed. Oh my gosh, my need for connection isn't met. Oh, I think I'll go to the church and find some people to connect with, or go to a group and get my needs for connection met, instead of jumping off a bridge, you know? So it's really true that if you don't know your needs, you're going to be spending a lot of your time doing things that are not helpful to yourself or to others. And I found that as a nurse, because I understand my needs and I understand the needs of my patients, I became very efficient. And I could get my job done in a few hours where everybody else was struggling to get it done by the end of the shift. So I ended up helping other people get their job done. But knowing other people's needs, you don't spin your wheels. You know, you can zero in on what the needs are and meet them if you choose. So the fourth step is request. I'm going to give you a minute to figure out what request you want to make to yourself about what happened. And it could be anything. Some of the requests that I've made to myself were, let's see, I wrote some down here. Oh, my big one was find someone to give me empathy. Because I found that when I got empathy, my external world changed. And it's weird. It was like magic, you know, but it's like I heal one part of myself. Empathy is healing. And then the outside world doesn't present me with that situation again. So that was usually my number one request. Change jobs. I did that a lot. But all nursing jobs are difficult. My strategy to learn nonviolent communication was a request to myself because it was so effective. I wrote a book because I didn't want to change jobs again, so I made lemonade out of lemons. Improved my physical health because as your body is healthier, you can tolerate the stress better. See a therapist. I tried a few of those too. What about you, Ruth? Have you made a request to yourself?
Years ago, I made a request to myself to, if I was going to call people a friend, they truly should be. And I kind of cleaned up my group of people that weren't actually friends. I was probably trying to take care of them or look after them or do things for them, but they weren't really friends. And I very consciously, for about a year, kind of said goodbye to them, found some closure. And then I made a request that I would only create friends that are friends.
Okay, so you kind of cleaned up your life a little bit by changing who were friends for you.
Yep.
Probably freed up a lot of time.
Yep.
A lot of mental energy, a lot of emotional energy. Yeah. But in this situation that we were talking about, what request can you make of yourself about that?
I could ask myself to just take a pause, not to be too reactive when I'm in a space where I'm feeling unsafe. Just to take a pause and find some sense of peace or a pause. It kind of goes along with Ian's idea of just being a little more present for that person that's
well, present for yourself first.
Yeah.
So talk about putting ourselves first. That's one thing you want to put first, you know.
Yeah.
When you're in a difficult situation and you're triggered, you're scared or whatever. Take a pause, give yourself a little empathy. That's what you do in the pause. Between stimulus and response is a space. And in that space, I put nonviolent communication because that space is, what did they say? Who made that quote? It's our humanity. It's how we determine how we want to respond. And I think it can change the world. Just use that space between stimulus and response. Yes.
Just thinking, and a few years ago, I had the privilege of hearing Dr. David Cool speak at McGill, and he set up the first palliative care unit in Vancouver. And he told a story about how he learned to stop at the doorway of going into a patient's room and put his hand on the doorway. And he said, and just empty myself before I went in. So he said, I was more present to myself that way, without all sorts of preconceived notions and judgments and whatever else, and therefore open to the patient. So he said, it helped me then when I encountered the patient to be more present all around to myself and to them. And that story has always stuck with me. A real teaching moment for me as I heard him say that.
That sounds like a wonderful idea. You know, I know when I was visiting patients in hospice, there's one house I'd go into that was scary for me. There's so much violence. So one day, I really didn't want to go. One day I built an ohm bubble around me. I go, ohm, you know, and I built it, and then I went into the house, and lo and behold, it was such a good visit, you know, none of that stuff happened. So I don't know. So I think that idea of being present to ourselves and kind of emptying ourselves, I think that's a great idea. Okay, anybody else made a request of themselves? Let's see, continue to insist on healthy boundaries with toxic people. Yeah, healthy boundaries are very important. To get out of your mind that there is such a thing as a toxic person. You know, there's some people that are scary to you, that you feel scared, but by labeling them toxic people, it's going to be harder for you to be present, harder for you to empathize with yourself or with them. Boundaries. Maybe we could talk about boundaries later, boundaries within VC. And boundaries occur in the language between people. And boundaries occur because you're owning what's yours. You have a feeling because you have a need. They have a feeling because they have a need, and that's basically the boundary. Knowing that and not mixing it up, not saying, I feel scared because you yelled at me. So right there you have mixed up the boundary. But if you say, I feel scared because I need safety right now, you have maintained your boundary. And that's a really important skill to know as a hospice nurse. What is theirs? What is yours? Permission to say no, absolutely. Learning to say your true no's and your true yeses. And that's part of being a doormat, is not saying our true no's. Mel, can you do this for me? Yes. But notice my face. Yes. You know it's not my true yes. And what happens when caregivers say yes to everything, they get really burnt out. So knowing how to say your true no's, knowing what your true no's are, some people don't even know because they've been socialized not to respect their true no's. They're supposed to do everything for everybody. It's about putting everybody's needs ahead of your own. So that has got to change. Asking for a moment when I need one, even to myself. Yes. Give yourself some time. Give yourself some space. And, a lot of people are scared that it's going to mean that they're going to not get done with their day in time, or it's going to take longer. And what I found that's not true. You give yourself a little space, and then your energy is kind of refreshed, and you can get done in time for the end of the shift or whatever. But yeah, giving yourself that space is an act of nonviolence. Understanding what my boundaries are, yes, and understanding of the feelings when these are crossed as they are mine to own. Yes, absolutely. So nonviolent communication is a guide to that, understanding what boundaries are, understanding your feelings, understanding what needs are not being met or are being met. One thing I do recommend is that people keep a journal when they're learning nonviolent communication. And in the journal, well, one thing you can keep a journal about is an appreciation journal. And this will uplift your mood too, just writing down any appreciation that you might have during the day. The other journal to keep is a jackal journal. You know, what are the jackals going on in my head? Write those down. Then say what feelings of mine were going on, what needs of mine are going on. So sometimes when you write things down, it just makes it clearer than just thinking it. I mean, I'm a writer. I've, written some books. So it really works for me to write things down. I kept a journal all my life. So I like the idea of Jackal Journal. It's kind of translate this habitual language of Jackal into feelings and needs. And remember just feelings and needs. If you don't remember anything else, remember feelings and needs. What are my needs? What are my feelings? What are your, and as you advance, once you figure out your own, you can figure out what other people's are. And then you can create a really nice dialogue between people of feelings and needs. Tools of nonviolent communication are, there are many of them: self-empathy, empathy for others, honesty. How do you express honesty in a gentle way, in a self-responsible way? So that's important to learn those skills.
Melanie, can I just ask something, or
Of course.
just contextualizing violence and nonviolence for people? Like, I know in some of the conversations I've had, nonviolent communication with people, we're used to a very set definition of violence. Like, people think about it in terms of physical aggression. And I'm not sure where people, here today are at, but like, I'm really appreciating that we're taking, I think, some time. And if you could just sort of reinforce the idea that violence is like, we could be violent with ourselves when we have these set ideas, or can you say a little bit more about that?
Yeah. One thing I have problems with people who don't want to come to nonviolent communication classes is they say, I'm not violent. And they don't realize how violent this language is and what the repercussions are. So when we blame others, when we judge, when we criticize, when we analyze other people, it's actually a form of violence. And it can create a lot of painful feelings in others. It can trigger these painful feelings. So let's see. So violent doesn't need to be only physical violence. I mean, that's the least of our problems. I mean, one day I was assaulted on the unit. I don't know, this patient came out of nowhere and started using me as a punching bag, so I hardly felt the punches, although I had bruises afterwards. I hardly felt them. But what was alive in me afterwards was my emotions and what I was thinking about it. And the nurse, the hospital nurse, called me and said, "Oh, how are you? I heard you got assaulted yesterday." I said, "Yeah, I'm fine. I'm fine physically. I just have a couple of bruises, but emotionally, I have some stuff going on." And she did not want to hear it. They had no capacity for listening to the emotional repercussions of this assault that happened. And I told them, you guys really, you really need to learn nonviolent communication. So, does that answer your question a little bit?
Yeah, it does. I just really wanted the space here to make sure people are understanding that, like, the way that our jackal language is like potentially, creating violence to ourselves and others.
Yeah.
But really understanding that, like, the more that we are present and honest and, I guess, authentic in our experience and our boundaries, and that's the practice of nonviolence, right?
Yeah. Yes.
Yeah,
And
thank you.
so the jackal will say, "Oh, I made a mistake. Oh, there's something wrong with me. I'm not good enough." All those internal jackals will drag you down. They will not elevate you. But listening to those jackals is important to begin to socialize yourself out of speaking like that to yourself. So instead you can say, I'm really sad right now. My needs weren't met for respect, for honesty, for consideration. That language will elevate you. Thank you for bringing that up. That's a really important concept. not taking the situation personally, not taking work home with you. Treat the person as you wish to be treated. Yeah. The more responsibility you take for causing someone's feelings, the less responsive you'll be able to be to those feelings. So, not taking anything personally. It's not about you. So remember that if you don't remember anything else. It's not about me. It's about them. It's about needs. Someone made up a little ditty. It's not about me. It's about needs. I'd sing it for you, but then you would leave. Yeah. Yeah, these skills are not just for work. They're for intimate relationships also, and they're vitally important to learn to use with your family, especially with your kids, well, with your significant other too. You don't want to perpetuate this language with your family. You want to use this language. This is a language of love, of caring. This language creates people that are wounded out in the world. What's the matter with you? That's not the way to do it. You're very selfish. So children take in those messages, and they don't feel that good about themselves. So they may stuff it down and then project it out onto the world at a later date. But those feelings need to come out. They're going to come out one way or another. If they don't come out by projecting it onto others, they come out in our health. I truly believe that. Anybody read Alice Miller? She's an old author and a psychologist, I think. She told a story about this woman who had cancer of I think it was the ovaries. And until she told the truth about her background, that her parents abused her, once she told the truth about that, the cancer went away. So that was kind of a miracle. And I'm not sure it always works like that, but for sometimes the emotions will express themselves physically. So learn to be honest about what your background is, be honest about your upbringing, be honest about your parents. I mean, you may break some rules. I broke a lot of rules in my healing journey. My mother said, don't air your dirty laundry in public. Has anybody else's mother told them that? Yeah. So even by trying to get empathy for this pain that I was carrying from my childhood was airing my dirty laundry in public, and it kind of made it hard to heal, but I've always been a rebel, so I guess that helped me do that. So I was able to get some empathy, and my depression started lifting. I was really depressed for a long time, so my depression started lifting. And whenever I would feel really down in the dumps, I would get some empathy and I would feel better. Journaling helped with that too. Journaling my feelings.
So I think some of the challenge in nursing is that we feel like we have a lot of things to do. We need to get things done. We have our list. And so, sometimes in our minds, we're like, well, why is this patient preventing me from getting my stuff done? But that's not really meeting them where they're at per se. So it's kind of like, maybe it's time for me to give you your meds, but you're not in a place where you can accept them from me. Well, then I need to, put that task down and physically be with you where you are.
Excellent. Yeah. It's about being present. Yeah, about giving them empathy. I had a patient once who was very obese, and every shift she would lay on the floor. And, as nurses, we don't like it when patients lay on the floor. So we'd have to call the lift team to get her back in bed. But one day, I had never taken care of her before, and I was assigned to her. And I just started the conversation by giving her empathy, by trying to understand what was going on with her. And that shift, the patient didn't lay on the floor. This was the first shift she didn't lay on the floor, and I didn't have to call the lift team. And when the head nurse saw that, she goes, "Oh, those meds must be kicking in." So, there was never an acknowledgement of the power of empathy. It was all about medications. It was all about violence.
I can
So-
say the same with some phone calls. Like sometimes at the clinic, we get phone calls and, the medical receptionist is a bit frantic. The person's kind of just like pretty agitated over the phone. And I've noticed that if I just validate the feelings at the beginning, wow, that's hard for you. Oh, you sound frustrated, whatever. Then the person seems to deflate really quickly, and we can really fairly quickly get into what's actually going on instead of me on the other end of a venting session, which sometimes that happens too, but I really find when the feelings are validated, it really changes the dynamic.
Yeah, that's de-escalation right there. Excellent. Someone asked about de-escalation earlier. So, validating the feelings and needs will almost always de-escalate somebody.
And I don't have to agree with their feelings to validate them at all. I can just hear the emotion in their voice. And, they don't need me to tell them how the healthcare system works right now or anything else. They just need me to, I don't know, see them, hear them, whatever the saying goes.
Yeah, you don't want to take on their feelings. And that's part of where the boundaries lie. Their feelings are their feelings, your feelings are your feelings. But communicating and understanding of their feelings is very healing. And I don't know if you can even do that if you take on their feelings. And I believe that is the difference between empathy and sympathy. In sympathy, you feel sorry for someone, you kind of take on their feelings. In empathy, you don't take on their feelings. There's a boundary there. You hear their feelings, you hear their needs, but you don't take them on. You don't take responsibility for them. The more responsibility you take for someone's feelings, the less responsive you'll be able to be for their feelings. So it sounds like you have figured that out. And you've been very effective in communicating with these patients, which is not always easy. So thank you. Can you provide advice toward communicating post a situation in nursing? I have heard what could you have done differently in this situation to better the outcome next time, which maybe it is me, but it feels negative to hear after going through a rougher situation. Yeah, absolutely. That it's not that when something disturbing happens, it's really difficult on you emotionally. And what you need in that moment is empathy. So you want to get empathy before even thinking about going to a solution. So oftentimes when you get enough empathy, you'll naturally find a solution that works for everybody. So empathy. So what is empathy? It's really understanding someone else's feelings and needs. That's what nonviolent communication defines empathy as. Yes, someone said the burden is placed back on the nurse instead of what barriers at this workplace cause this situation. That's always true too. What are the systems at play? And that's one thing that came up when I wrote Humanizing Healthcare. What systems were at play that made being a nurse so difficult? So some of that is in there. It can certainly feel frustrating as you can come out of a situation feeling as though you de-escalated well, and then you have a review and it can make you then feel like you didn't do well. So you start with positive self-thought, then left feeling negative about this. Yeah. Sometimes those reviews can be very painful because you're not being seen accurately for who you are, for your contributions that you made. And that's really important because you're giving yourself all day long So it's nice to be seen. It's nice to be recognized for your contributions. And that's a strong need, is to contribute, to make a contribution to others, is to serve life. So being seen for that intention is really important. How do we support working within a team when members may perceive every word, tone, expression as a threat? When working in healthcare, there are times of crises where decisions, tasks are delegated in a direct manner for safety. So it sounds like there's two things going on there. You're working with healthcare members and they hear what you say is a threat. I think a little vulnerability goes a long way. So, or a little empathy to them. Marshall Rosenberg, who created the process, told a story about when he was giving a talk. He used to have long hair, and he was in the South, and he was up on stage, and no one was letting him in at all. And so he started to try to empathize with the audience. What's going on? What's going on with you? No one's saying anything, and I'm just wondering if you're feeling angry or whatever. And finally, someone in the audience said, "It's your hair, man." So, so that's how he did it. He directed his empathy toward them. In another situation, this is kind of a famous situation that he talks about. He was in a camp in Israel or someplace, and he went in, and the audience member yelled out, "Murderer!" because they had noticed the bombs had been dropped and the USA was on the bombs. And so Marshall gave the guy empathy. Are you feeling angry because you need safety for your children? Yeah, those Americans, they think they can sell their weapons, and so you want there to be more responsibility taken for what we do with our resources. So he stayed with the guy, and after that, the guy's energy totally shifted, and he invited Marshall to a Ramadan dinner, which was a great honor. So yeah, the power of empathy. Oh, Marshall told a story about sitting in a group of gang kids, and he was giving a workshop with them. And Marshall was trying to empathize with one of them, and he said, "So are you feeling scared?" And the guy jumped up, and he's this big guy with tattoos, and he gets in Marshall's face, and he just goes, "I'm not scared, man. I'm never scared." And so the rest of the workshop, Marshall didn't say anything. He was just present. And after the workshop, some of the guys came up to him and said, "That was the best workshop we've ever been to." And the guy who said, "I'm not scared," he followed Marshall out to this car, and he wanted to work with Marshall. So Marshall ended up taking him to the next appointment of this guy who, I don't know, to make some financial contribution. So, Marshall was always doing these really wild things like that. It was fun. So sometimes, no matter what you say or do, somebody's going to have a reaction. So even being silent, I sense the participants in that workshop, sense that Marshall was present. He wasn't like making faces or raising his eyebrows. You can sense when someone's present.
Melanie, can I just ask one quick question then? So just further
Of course.
to our responsibility as providers or carers is to, to sort of be thoughtful about our language and potentially our facial expressions. And so from there, we are imperfect as humans, right? So it's about one, doing these pieces of work, making a righteous effort. And then what? And then kindness to ourselves when we have an eye twitch that, somebody else happens to feel offended by.
Absolutely. Be kind to yourself.
Okay.
Yeah. You can't prevent someone from having a reaction, but you can express your needs, and you can say, I'm hearing that you're feeling angry right now, and your need for respect wasn't met when you heard me say what I said. And I'd like to put that in a way that would better work for you. Is there something I can say or do right now that would feel better? You know, so you can try. You know, it's really about paying attention to the other person. You know, like I had a handy woman wanting to come over the other day. We had an appointment. So I waited and waited, and finally she texted me and she said, oh, I'm running late. And that was it. So it turned out to be 5 o'clock in the afternoon. I had waited all day for her. And she didn't call me, no call, no text. And I called her and I said, are you not coming today? She goes, oh no, you know, I got tied up, you know, at that job, and you know. So there was no like, God, how was that for you, Mel, sitting around waiting for me all day? You know, there was just, oh, well, I got tied up. That was about her. It wasn't about me. So it's kind of about being generous with other people, understanding what they're going through, putting yourself into their shoes, and making a little bit of space for that. I mean, if she had just said, oh, I got tied up at work and I realized that you must have been waiting all day, that probably was pretty frustrating for you. You know, at least she would have showed some consideration and empathy for me. Or even if she doesn't know NVC, she can say, I guess that didn't work for you too well. You know, at least, you know, in any kind of language, show some consideration for the other person. So yeah, does that answer your question, Tara?
Yeah, I think that helps. I think it's, yeah, so it's not like we have to be perfect the first time around. There are opportunities for further communication to, you know,
Yeah.
to work on.
But that's,
you know.
yeah, that's one of the great things about your job, is that you can grow and learn every day, you know, and by making mistakes, we learn. So, but to make those mistakes, you have to stick your neck out. Like a giraffe has a very long neck. You got to stick your neck out and be willing to try something new. When I first started learning nonviolent communication, I was using empathy on my patients, and I said, oh, they're gonna think I'm screwy, you know, this isn't gonna work. But everyone really liked it. Everyone loved the empathy, you know, and no one noticed that I was doing anything weird. So really trying something new is you're not always going to succeed, but that's what the Jackal Journal is for, and that's what Empathy Friends are for. And when I have a group, I always ask people to find a partner to become empathy buddies, and then to spend like an hour on the phone every week calling each other and practicing the empathy skills. Because what it takes to learn nonviolent communication is it takes your intention, it takes practice, and it takes support. Because whenever you're changing something as deep as language, you need to be supportive and you need to practice it. It is our natural language. We're born speaking giraffe, but we get socialized out of it. So, but it's still in there. So remembering what our natural language is, that is part of the lessons of learning nonviolent communication.
Sometimes what's happened with me is I'm relatively fluent in sign language, and the deaf community taught me this one. So I laugh. But yeah, after showing that empathy, which is really important, and doing what you're talking about, of seeing if there's a way to help someone else, how they reacted to it, even though it's their responsibility for the reaction, is that at some point, out of sight of them, there's a sign that the deaf community uses. It's like this, and you go, like, it's not my responsibility. You flick it off. So sometimes that can be helpful.
That could be very helpful.
We're gonna know now, Ian. If you
That's right.
not on us.
Everybody's going to go around. Are there any questions, burning questions, that we can address with the few minutes that we have left? The steps of self-empathy. Well, the 4 steps of empathy is observation, feeling, needs, and request. Self-empathy has 5 steps. The first step is connecting with your thoughts, connecting with your jackal thinking. Then it's the same: observation, feeling, needs, and request. So these are my books, the ones that I wrote, Humanizing Healthcare. And then I also wrote a workbook called Choose Your Words. And this would be valuable for all you caregivers because it's written in the perspective of toward a therapeutic relationship, a professional relationship. And then stay tuned for my book, Zuma Earth Alien. You'll probably learn more nonviolent communication by reading that book than by reading Humanizing Healthcare. You know, the thing about feelings is people often deny their feelings because we're socialized to push them down. So understanding what our needs are is very valuable. So when I empathize with patients, sometimes I'll just go straight to the need and I'll skip the feeling because feelings can be a little, can bring up stuff for people. So sometimes I'll skip the feeling. So yeah, knowing the need is really important. Thank you all very much for your attention and for inviting me here.
And I'm sure there'll be a number of more people after today that'll be reading your book, Melanie. So on behalf of all the participants and the folks from the Champlain Hospice Palliative Care Program, we want to thank you so much for joining us from California and sharing your wisdom for us. And doubtless we'll carry this into our practice and our personal lives as well. So thank you so very much.
Thank you.